The anterior approach is really just is how you get down to the hip, and so the replacement part or the actual bony work is going to be relatively the same whether you have an anterior approach, lateral approach, or a posterior approach. It's different in the fact that it's done laying on your back instead of laying on your side. We can use X-ray in surgery a lot more easily, and the main advantage is really that the recovery is a little quicker in those first 6 weeks after surgery. Anybody that walks in the door is a candidate. Certain things that will rule you out from having an anterior approach is if you have a really complex problem with the back of the hip, if you're having recurrent dislocations posteriorly, or they're very once in a great while we'll have patients that just their body habitus does not allow for an anterior approach, but that is exceedingly rare. So in my practice, essentially anyone's a candidate for an anterior approach. Well, here we have a hip model. I'll point you right here to this part of the pelvis, which is the main landmark we do that we look at during the surgery. It guides us to the correct interval, which is just to the lateral aspect of this little bone here. We make the incision and spread the muscles apart. Keep in mind this is a muscle sparing approach, so we don't cut any muscles directly, we just spread them apart. In this model, the actual femoral head has already been removed, but we'll make a cut of the femoral head, which allows the femur to fall out of the way. Then we use a reamer to clean off the hard bone that is developed in the acetabulum, and we take an acetabular component that looks like this and insert it into the socket. Now this part is 3D printed, and it grows into the bone around the pelvis. That's followed by the insertion of this plastic piece that serves as the bearing surface. Next, the femur is moved up into the wound, and a pathway is made for the femoral stem, which is then press fit into this part of the bone. A ball is placed on the top of the femoral stem, and the hip is reduced, followed by the closure. So that's a good example of what a total hip looks like in surgery. So the original pain, that grinding, stabbing pain that a lot of patients will feel radiating through the front of their hip, typically goes away within the first day or two, if not the first day after surgery. The surgical pain will typically subside around the 2-week mark. Most patients walk in with the aid of a walker day of surgery. The majority of patients are able to leave the hospital on the day of surgery, and most patients are off a walker by somewhere between 2 and 6 weeks, sometimes as early as that 2-week follow-up. The definite time to come in is if you have bone-on-bone hip arthritis and you've seen an X-ray and the bones are touching, you should come have a chat, because the number one, hip replacement is a fantastic surgery. It's a great option. It can vastly improve your quality of life. But there's some patients that have bone-on-bone hip arthritis and don't have a lot of pain. So there's other conservative management options, such as injections, or even just getting some knowledge and some expectations on what to expect. So all those are reasons to see a hip specialist. I'm Dr. Nathan Haile. We're here at the Alliance office. If you have any problems with your hips or your knees, give us a call and we'll be happy to take care of you.